kondom dan juga tuala wanita itu tidak biasanya dikaitkan ketika kita ingin membantu mereka yang diancam bencana dan juga krisis di seluruh dunia, krisis kemanusiaan terutamanya. Tapi itulah yang ingin saya bincangkan malam ini, membawa kepada perhatian kita terhadap sebenarnya bahawa kesihatan reproduktif itu juga dan aspek penjagaan seksual itu juga penting, ya, terutama bagi wanita yang dilanda oleh pelbagai bencana dan juga krisis kemanusiaan. Dan ini semakin memuncak kerana ia akan menjadi satu lapisan masalah berganda para wanita jika tidak difikirkan. Malah agensi-agensi antarabangsa juga kadang-kala tidak melihat ke arah ini. Oleh itu saya berbangga malam ini saya ada seorang tetamu dan oleh itu saya terpaksa berbicara dalam bahasa Inggeris. I would like now to introduce my guest for tonight, Sarah Chynoweth. I hope I pronounced that correctly.
Yes, good job.
She is an expert in sexual and reproductive health in emergencies situation, and she is the advisor in that role for the International Planned Parenthood Federation, East, Southeast Asia and Oceania region, which is based in KL actually. So you're also an sort of a academic on this because you're doing your PhD, right?
I am,
okay.
Yeah. Theoretically, I'm doing my PhD.
So we have a good balance here. And you're also the co-founder of a non-governmental organization called Circle of Health International.
That's correct.
So that's quite a 360 view on this topic. But before I go any further, I'm sure, because I mentioned condoms and sanitary pads in my intro.
Okay.
So that will shock a lot of people because people don't equate that with humanitarian assistance.
Yes.
But you've been to looking at the situation in a lot of countries, from the problem in Iraq to like Haiti or even the African countries and even in Sumatra. So if I can draw a line here and make you commit to it,
yeah.
Why do me and the rest of the people in Malaysia need to know that sexual reproductive health and well-being is very, very important, especially to women, in as far as humanitarian assistance is concerned all around the world when crises or disaster struck?
So this is a really important question that few people ask because the focus is usually on food, water, and shelter. But what people don't know is that most crisis populations are made up of women and children, up to 80%. So it's not just a small percentage, but the vast majority. The other issue is that reproductive health issues are the leading cause of death and disability among women around the world, and that's during normal times. So when a crisis happens, you can imagine you have access to services, you can't get to the hospital, maybe your clinic has been washed out, if there had been floods. So that's really the essence, is that this is life-saving intervention. It's not a luxury, it's not a second-hand concern. These are interventions and services that will save women's lives.
Why is it that not many people seem to notice that? You know, even when you talk about big agencies, press conferences done by these agencies, they don't mention this. You know, maybe they do, but not outrightly. And then maybe that's why it's a bit of under the radar kind of awareness on this.
Yes, it's a good point. There isn't much awareness on sexual and reproductive health and emergencies, and I think that's due to a number of reasons. One of them is that it's kind of behind the scenes. So when a crisis happens, you see people who don't have enough to eat, they're starving. You see people who have lost their homes, who need tents. You see people with their, damaged bodies, who are hurt, who are injured, who need to go to the hospital. But the reproductive health issues are sort of, like I said, behind the scenes. For example, sexual violence or rape. Rape isn't usually happening out and about. That's kind of happening behind closed doors. Also with pregnancy, women aren't generally giving birth out in the streets. HIV, sex, all those things happen sort of behind the curtains. So I think there's a lack of awareness just because you don't see it very often, but it is happening and the consequences are dire if you don't address it.
I would like to link this to the bottom billion. Somebody in USM might be smiling now because that's a crusade down there in University of Science Malaysia to look at the plight of the bottom billion. And when we talk about disaster and calamities and also conflict areas, most often we talk about this bottom billion group because they are the less educated, the less privileged in terms of having wealth. So is that compounding this problem more and more in your point of view?
Absolutely. About 65 to 70 million people in the world are displaced by conflict or natural disaster. So, and a lot of the communities that are most affected are the most vulnerable. So, for example, in Haiti, I was in Haiti a few months ago, and you could see that the most affected were the poor and the vulnerable who didn't have good infrastructure, and the better houses stayed intact after the earthquake. But we also have to remember that this can happen to anyone. This can happen in Malaysia. It's happened in the United States after Hurricane Katrina. So it's important to remember that, yes, the most vulnerable are affected, but it can happen to anyone as well.
I promised you before this show started that I'm not going to ask too many questions tonight. I just want to hear stories, because I think stories of human plight and suffering will say it all. We don't need to over-editorialize the discussion. So if I can pick up an example from Darfur, because, you know, I would like to go to the first point that I think is very, very, you know, we think we know it, but when it happened, it will still shock us to the bone. And about how women will be the first group systematically targeted in the conflict area, for example. So how do we link that sexual reproductive health, for example, to the situation that happens or is still maybe happening in Darfur?
That's an excellent parallel, is that war and conflict are played out on women's bodies. There's this idea that, oh, rape happens just as a side effect of war, but it's actually a strategy of conflict in many settings, because by raping a woman, you're not just affecting her, you're affecting her family. Her family is devastated. You're often affecting her whole community. And that is what was happening in Darfur, and continues to happen to a certain extent, is this very systematic rape of of Darfuri women. But it is quite depressing. Being there, it's difficult to see. But I'd like to highlight a good story, a positive story. In South Darfur, there is one of the world's biggest refugee camps, or internally displacement camps. About 80 to 100,000 people in this camp, which is like a city. And it's very depressing. Squalor, there are children running around naked, people don't have enough to eat. It's pure suffering. And in this camp, one agency set up a women's center. So it had very high bamboo, just something very basic. And inside this shelter, only women were allowed to go in. So you'd go in, it's a fairly small space, and you'd see children on one side and women on the other. And what would happen is that every time a woman was raped, she would be brought to, after she received medical care, she would be brought to this center. All the other women who had been raped would come to her, would wash her, clean her body, put oils and henna on her, and make her feel loved and beautiful again, because rape is such a deep violation. And so even in the most dire settings, you do see these sparks of hope and humanity everywhere you go.
Okay, that's a good positive story, but I would like to link that. And we have to go for the first commercial break. But after this, maybe sometimes it's people coming from the outside that has a bit more baggage than compared to people living and accepting the harsh realities of conflict areas. For example, if there's a lot of volunteers coming in, and maybe to a lot of people that we don't have time to address this issue of rape right now. But the question is, I saw what was on the internet, I read also and listened to the podcast. But when is the right time to discuss it, for example, on the other side? So let's discuss that very complex but sensitive topic after this short break.
Pikiran dan rasa terjamin adalah perasaan yang amat berharga. Nikmatilah kedamaian ini dengan akaun emas Kuwait Finance House. Masa hadapan adalah emas.
Setiap Sabtu, Astro Awani membawakan Business Awani Plus. bersama Rizal Zulkafli dan Syafizan Johari.
Saya tak putus asa. Saya belajar lagi. Saya ubah suai.
Rangkuman berita perniagaan dan ekonomi meliputi 5 berita mingguan terbaik.
FTX being really the gateway to Asian capital markets.
You'll be surprised at the level of innovation that can come from the students.
Ketahui prestasi dan prospek mingguan pasaran. Business Awani Plus, Sabtu 6.30 petang di Astro Awani. Berita segenap dimensi.
Rabu di Primawara.
Kami nak pergi serang cucu pada reh tu.
Halimah nak diserang.
Whatever. You're not good enough to be my friend.
Apa lagi yang tak kena?
Kahwin lah dulu. Baru ada feeling.
Lebih kuah dari sudu.
Dia tu kotor, busuk, masam.
Halimah betul-betul nak rahsia bos? Jumpa tengah hari nanti.
Apa Ali ni?
Halimah Jongang musim baru Rabu hanya di Astro Prima.
Setiap Ahad, bukan gosip semata-mata, tapi fakta dan informasi dunia hiburan.
Kami dah suka, cinta sama cinta, sayang sama sayang.
Seorang penulis buku belum tentu mampu menulis sebuah skrip.
Sempena kempen di manakan ku cari ganti, 15 penghibur bergabung.
Kes Cemang tahun ni, kebanyakan mereka adalah yang muda-muda. Berapa bintang yang PAS boleh beri untuk filem Let Me In?
3.45.
Gala TV Plus, Ahad 4.30 petang di Astro Awani. Berita segenap dimensi.